Hey class, it's Cassidy. I'm going to talk briefly for a few minutes about lung cancer and the basics. So every cancer has a color ribbon, and for lung cancer, the color is either clear or white. This was originally created because of reference to how our air is pure, and nobody really thought of it. And most of us already know that cancer is a mutation of abnormal cells, and this is exactly what lung cancer is. Lung cancer is uncontrollable growth of abnormal cells in either one or both of your lungs. These abnormal cells don't have any normal function or can create healthy tissue for your lungs either. As these cells continue to grow, they can create tumors and interfere with your functions of your lungs, such as producing oxygenated blood and moving it throughout the body.
My name's Tyler Hubert, and I'm going to talk to you about the leading causes of lung cancer as well as some signs and symptoms. As you all may know, the biggest leading cause is smoking. It accounts for about 80% of death in lung cancer. Another cause is radon as well as secondhand smoke. Air pollution is a big cause, and for non-smokers, asbestos, diesel exhaust, or other certain chemicals can cause lung cancer. 25% of people have no signs or symptoms of lung cancer when the cancer is found, so it's kind of difficult to tell if you have lung cancer. But some ways you could detect it is a new cough in a smoker or former smoker should raise some concern for lung cancer. A cough that does not go away or gets worse over time should be evaluated by a healthcare provider. Coughing up blood occurs in a significant number of people who have lung cancer. Any amount of coughed up blood should be evaluated by a healthcare provider. Pain in the chest area is a symptom in about 1/4 of the people with lung cancer. The pain is dull, aching, and persistent. Shortness of breath usually results from a blockage in part of the lung, collection of fluid around the lung, or the spread of tumor through the lungs. Wheezing or hoarseness may signal blockage or inflammation in the lungs that may go along with cancer. Repeated respiratory infections such as bronchitis or pneumonia can be a sign of lung cancer. Lung cancer most often spreads to the liver, the bones, and the brain. Metastatic lung cancer in the liver may cause yellowing of the skin and eyes, but it may not cause any noticeable symptoms at the time of diagnosis. Lung cancer that has metastasized to the bone causes bone pain, usually in the bones of the spine, the thigh bones, and the ribs. Lung cancer that spreads to the brain can cause difficulties with vision, weakness on one side of the body, and it may cause seizures as well.
My name is Joey. I'm going to talk to you about stages and treatments. Stage 1 is obviously the earliest stage. It's non-small lung cancer. Treatment, surgery to remove the tumor, then leads to chemo. Stage 2, and also a non-small lung cancer. Treatment is chemo. Typically, it's a greater than 3 centimeters. Stage 3A, tumor is near airway or has spread to areas near chest wall. Stage 3B, tumor has invaded chest, heart, or esophagus. Treatment, surgery to chemo, clinical stage, and also radiation is optional. Stage 4, metastatic, tumor is spread to another region of the body to another lobe of the lungs. Treatment is radiation, chemo, surgery to remove the tumor, and that's all.
Hi, I'm James, and I'm going to talk to you about the survival rates and the prominence of lung cancer. The survival rates differ from different stages. In stage 1, the survival rates are actually more than 70%. In stage 2, the survival rates are about 60%. Stage 3, the survival rates are actually about 40%. And then in stage 4, they're less than 10. Stage 5, the survival rates are actually less than 5%. And overall, over the past 5 years, the survival rates for people with lung cancer have been at 15%. And the reason for that is obviously, as we talked earlier, the fact it's very hard to detect lung cancer until it already has gone into the advanced stages. And the fact that what makes lung cancer prominent is the fact that you can get it without even smoking, get it without being around secondhand smoking, get it from air pollution like we talked about earlier. So
that's our presentation on lung cancer. Be safe, live healthy, don't smoke.